until this study was completed, we didn't have enough overview of like the longitudinal the change in cost in programs over time. So this is probably the first study that tries to do that. Okay. Right. Okay. So school meals programs are very important social safety net tools for especially for low and middle income countries globally. So there is a new WFP report on school meals that was launched just earlier this week. And the report puts the total number of children that benefit from school meals globally at 466 million. So that's a significant increase from 2 years ago. And the total spending on school meals globally is now around 86 billion investment, 86 billion annually. So that shows you how important these programs are and for governments and how much money is at stake. But even though these programs are important politically and socially, there has been issues around funding adequacy, whether these programs are efficient in terms of cost, and also whether there is sufficient nutritional quality in this program. So at least this is what the issue. Two of the teams have been focusing on, the Gambia team on both the Gambia and the Ghana team actually, have focused on funding adequacy, nutritional quality. At least the Ghana team, the nutritional quality has been at the center of their problem statement. So these are issues that are relevant for most programs in low and middle income countries. And so it's important that we have a good understanding of how these issues are interlinked. We need to have empirical data in order to make evidence-based policy decisions. So this study presents an analysis of longitudinal data. So it's data collected over time, over 5 years period. And it covers not 216, it's actually 256 programs in 102 countries around the world. Okay, so the research questions that we try to answer in this study are how do costs per child vary across programs and over time? So that's what I refer to as benchmarking. So and then also over time, not just at one point in time, but also when programs expand, how do costs per child vary? How does nutritional quality or dietary diversity relate to costs, the relationship between cost and quality? Which program features influence cost? So what's the correlation between the choice of program design, where the food is sourced, how the program is implemented, how targeting is done, and the cost. So I think this is important in terms of program design choice. And the last question we tried to answer is how efficiently do programs scale in different contexts? So scaling is important. There is significant, like I said, there's significant expansion in these programs across the board, and especially in Africa. There has been an increase of, I think, 220 million children over the past 2 years. 20 million children have been included into school feeding programs. So how efficient is that expansion in terms of cost per child? So that's the last question we try to answer in this study. So the data is from the Global Child Nutrition Foundation, a GCNF survey. So they collect data every 2 years from programs around the world. They have a very wide coverage. So they collect data on at least 120 or between 120 and 140 countries every 2 years. So this has been the data has been collected from 2018 to 2023. I think some of the programs that you deal with, at least the Ghana program, and I'm not sure about Gambia, but I think at least on some of the surveys, your programs are also included. So the sample is, like I said, 264 programs, 102 countries. So there's a lot of data, quite comprehensive program level data in this survey. So we are able to calculate cost per child for all these programs, at least for the programs that we have data, cost data and coverage data. We are able to measure the dietary diversity in these programs because the data covers the type of food groups that are included in the program. So we can measure dietary diversity. We can obviously measure program scale because there's data on number of children covered. There's also data on different program features like sourcing models, so how food is sourced, how it is prepared, how the program is implemented. So because we have a lot of program level data, we were able to do rigorous analysis of the cost and efficiency of these programs. In terms of methodology, so we standardized cost per child. So when you talk about cost per child, it's not just the annual cost per child. I think if you want to do a comparative analysis between programs, you have to standardize that cost. So you have to determine what type of, so is it a snack or is it a full meal? So we only included full meals because some programs only provide snacks. So it's not appropriate to compare programs that provide full meals with programs that provide snacks. So this is only on programs that provide full meals. We also standardize the number of days because different programs provide meals on different number of days per year. So we standardize it to 200 days per year. We also standardize it. We standardize the measurement to purchasing power parity. So it's not the current dollar values or current local currency. It's purchasing power parity. So like the cost numbers can be compared across countries. We also adjusted for dietary diversity, like I said, because you cannot just talk about cost without taking into account the quality of the food. So we have data on the diversity of the meals. So we adjusted for dietary diversity when we calculate the cost. So it's because we have data for a number of years for a number of programs. We run a panel data analysis. And we also calculated the cost of scaling because we have data on the expansion from 1 year to another and how much it costs when programs expand. Okay, so now I move to the main findings. I'll show you the main findings of the study. So in terms of cost patterns, so this is for income groups, for high income countries, upper middle income countries, lower middle income countries, and low income countries. So for example, so of the 3 countries in this cohort, I think Liberia and Gambia are low income countries and Ghana is a lower middle income country. But if you look at the trend for the low and lower middle income countries, there isn't much of a difference. So if you compare 2018, 2021, and 2023, the spending, the per child spending or cost has not changed a lot for this group of countries. So there is a significant difference between how much high-income countries spend and low and lower middle-income countries spend. There's around a six-fold difference. So high-income countries spend 6 times more per child than low-income countries. So the significant increase in high-income countries in recent years, I think it has to do with the food price inflation, because there has been massive food price inflation across the globe. But the difference between high-income countries and lower middle-income countries is that high-income countries usually adjust their spending when there is inflation. And I think this is an issue, especially the Ghana team has been grappling with. There has been significant food price inflation in Ghana over the past few years, but spending has not, the budget allocation has not kept up with inflation. So that's why you don't see a significant jump in these countries, whereas there is a massive jump in high-income countries. But spending, the increase in spending does not necessarily imply value. So if spending, you may increase your spending, but if spending is inefficient, so that does not necessarily increase the value in the program. So that's not always a good news. So that's why we need to take quality and to some extent quantity into consideration, because we don't have good data on quantity in this data set. And also quantity is more or less, it's less of a problem than quality in most programs. So we focus on quality. So we adjusted the cost for nutrition diversity. So this graph shows you the average adjusted and an adjusted annualized cost per child by income group. So this is adjusted for dietary diversity, and you could see that the cost per child for low-income countries, which is the unadjusted one, is around. So the average for low-income countries is around 110 purchasing power, PPP dollars. So in PPP terms, it's around $110 per year. When you adjust that for dietary diversity, so when you assume like full dietary diversity, if these programs provide like the full range of nutritious foods in their programs, the cost would increase significantly. So it would increase, depending on the type of adjustment, it would increase to 228 for low-income countries or 300. So programs in low-income and lower middle-income countries may seem inexpensive compared to, for example, high-income countries, but that's because the food that they provide is less diverse. So there isn't as good quality. These aren't as good quality meals as, for example, upper middle-income countries or high-income countries. So when you adjust the cost for dietary diversity, the real cost that they would spend increases significantly. So it would be comparable to what upper middle income countries are currently spending. So this shows you that the cost usually masks the lack of quality. So when you only understand the difference in you can only compare cost between programs and countries once you've adjusted at least for some measure of quality. And this is what we try to do here. So another manifestation, so another way to show you what the difference between adjusted and unadjusted cost, what happens when you adjust for dietary quality, is these two graphs. So these are two different adjustments. So that we use two different measures to adjust for dietary quality. And each dot represents a program, and it shows you how significantly cost increases, cost in low-income countries and lower middle-income countries increases when it's adjusted for dietary quality. So so the black dots are high-income countries, and they are the adjusted and the unadjusted cost is almost the same for high-income countries because they provide a full range of nutritious foods. These programs in high-income countries provide a full range of nutritious foods. So it doesn't make a difference for these countries whether you adjust the cost for dietary diversity or not. So it's a straight line. But especially for low-income countries like Gambia and Liberia, and for lower middle-income countries like Ghana, the cost jumps significantly when you adjust. So the amount of spending, the amount of budget you need to allocate, if you were to cover the full range of nutritious food, is significantly higher. And I think you already know that there has been a costing exercise, at least for Ghana, that showed the cost per child would have to increase probably by 150%, 200% if the meals have to fulfill all the at least the basic standard, the dietary diversity conditions. Okay. Okay, so this has another way of looking at this is funding adequacy. So this means if the cost would increase significantly when you adjust it, the current funding, it means the current funding is not adequate. And one way to measure this, to benchmark this, is the cost of the FAO's. The FAO collects data on the cost of healthy diet for almost every country in the world. So you can use that data to benchmark the current spending and how adequate it is. And we did that for all programs we have data for. And so the FAO cost of healthy diet gives you the number, the amount of money you need to buy a healthy meal in each country. And we have data on actually how much these programs spend. And so when you compare those two numbers, 63% of the programs are underfunded. So they are currently funding less than one healthy meal per day. So that's what the graph shows you. The horizontal line, which is one, is that the cost of the number of healthy meals that you can buy in a country with the amount allocated. And most programs, especially in low and lower middle income countries, are under that line. So that means they're underfunded. They cannot, the current allocation cannot buy one healthy meal. And that's a different story for high income countries, obviously. And it's not just about this objective benchmark. If you ask the program implementers, 50% of programs in lower middle income countries report inadequate funding to meet objectives. So it's both based on both objective and their own assessment, this assessment of inadequacy. So there is a significant lack of adequate funding for school meal programs, especially in low and lower middle countries. Okay. So funding adequacy is one thing. We need to adjust for quality. The adequacy is important, but we also have to look at efficiency, how efficient these programs are. So given how efficient are they in using the money that they are allocated. And so in order to do that, we looked at the correlation between the cost per child, the adjusted cost per child, and different program characteristics. So which program features, which program design features are correlated with higher cost efficiency. So we've looked at a number of program features like targeting, sourcing, and meal preparation. So if you look at, for example, targeting, so this looks at whether the program is targeted at the individual level, so whether it targets individuals, or whether it targets schools, or whether it targets geographies. I think in most of the programs in low and lower middle income countries, it's geographic targeting, but there are some programs that also use individual targeting. For example, I think the Ghana school feeding program is geographically targeted. So it targets certain areas, and within those areas, it covers all those primary schools. Our findings show that individual targeting lowers per child cost in richer countries. So that, I think, that was to be expected, because in high-income countries, it's easier to target individuals, because the targeting, you have enough data to discriminate between individuals, so you can do that. But it's less efficient. So individual targeting is less efficient in low-income settings, like your countries, because the administrative burden, there's a significant administrative burden. You cannot really target individuals. You need a lot of data, and it's very expensive to administer this targeting. And there's also widespread need. So because the need is very high, it doesn't make sense. It's not efficient to discriminate at the individual level. So it makes more sense to target schools or geographical area. The second design feature we've looked at is sourcing. So how food is sourced and how that correlates with the cost, the adjusted cost. And then the results show that local procurement can cut nutrition adjusted costs. So because there is a cost saving in terms of transport, storage, and also you can procure seasonal produce more efficiently when you source food locally. But the key condition here is for this relationship to hold, the programs need to be adequately funded. At least there needs to be some baseline level of funding. And once that there is that level of funding, you can make the program more efficient by procuring locally. The third feature we've looked at is meal preparation. So how and where the meals are prepared. And our results, so it's not a conclusive finding, but at least most programs that prepare food in centralized kitchens tend to be more cost efficient. So there is a correlation between on-site cooking, so cooking food on-site on school premises appears to be less cost efficient. And I think you can expect that because it's centralized cooking where it is feasible gives you the scale advantage. So you can build bigger kitchens and you can procure food in bulk. So that gives you a cost advantage, and it leads to more cost efficiency. But there is usually a trade-off between efficiency and social goals. So most programs that cook food on site are doing it not for the cost reason, but for other political and social reasons. So to create employment for women locally and for community participation. So those are the reasons meals are cooked on site. But it's important to note that there might be a trade-off in terms of efficiency. Okay. All right. Okay. So now let's look at the cost and scale dynamics. So how does cost change when programs increase their coverage from time to time? So here we're looking at two time periods, 2018 and 2023. So these are programs we have data for 2018 and 2023. The blue dots are for 2028. So that the blue dots represent the cost per child and the number of children covered in 2028, in 2018 for each program. And the orange dots are the same measurement, the cost per child and the number of kids covered in 2023. And the arrows show you how cost per child changes as programs expand or sometimes shrink. And then on the left-hand side, so that's for low and lower middle-income countries. So the countries that are relevant for you, you can see that there is usually a cost saving when programs expand. So if you just look at the Benin and Nepal, for example, uh, the coverage, the number of kids that are covered in 2023 um, has increased significantly, so compared to 2028. But the cost per child has declined in those cases. So that shows you there is a cost saving, that there's an economies of scale. So the larger the programs are, the lower the cost per child. So that's not always the case for all programs, but that's usually the case. That in more cases than in low and lower middle income countries, when the programs scale, the cost per child decreases. Um, on the right hand side, that's for low high income countries and upper middle income countries. For countries like United States, Cyprus, Greece, and there you can see that there's only an increase in cost per child. So the programs do not usually expand because I think the need is usually made, but because there is a significant increase in cost per child, and so there is less economies of scale in high income countries compared to low income countries. And we have another way. We try to come up with a different with one metric to measure that. So we call it the cost of scaling index. So that measures how much cost increases or decreases when programs expand. And if the cost of scaling index is less than 1, it means cost grows slower than coverage. So when you increase the number of children in a program, the cost per child decreases. So there is economies of scale. And the graph shows you that the cost of scaling increases with income. So the lower your income as a country, the more efficiently you're able to scale your program. So there is that advantage for lower income countries. They can scale their programs more efficiently for a number of reasons. Okay. So this is the last slide. Just to conclude, based on these findings, so we've a few food for thoughts for policymakers. I think that the most important message here is what's in the school meals matter. The quality and the diversity of meals is central to the analysis of efficiency. So when you measure value for money or efficiency, you have to look into the quality and the diversity of the meal. It's not just about the cost per child without, regardless of the quality. Quality is important. The second message, I think, is it's encouraging that coverage expansion in low and middle income countries is efficient. So the graphs that I just showed you, their programs can scale up efficiently, but it should be matched with efficiency in improving quality. So that efficiency in expansion, should be matched with improving the quality, the nutritional quality, and the diversity of the meals. Oftentimes, governments just focus on getting more kids onto the program and that might sometimes undermine the quality of these programs. And finally, there are different ways to improve cost efficiency. So one size fits all design might not always work. It might undermine cost efficiency. So you should take the context into account when you design a program from a cost efficiency point of view. So a design that reduces cost in one context might not always work in other contexts. So we think these are the lessons for policymakers. I'll stop here. I'll be keen to hear from you if you have any questions and comments. Thank you. Um, I think so. I've already said it. So so the quality is key, and it's usually overlooked in government programs. So I think the most important thing, consideration for at least public finance officials for ministries of finance is how do you tackle this challenge? So because there is limited fiscal space, so you cannot. So if you look at the numbers for low income countries, for example, let's just go back to this figure. So if you were to if you were to cover all nutritious food groups in your programs, your the cost per child would triple in most countries, and I think that's the case in Ghana. There's an independent costing exercise that was done, and that showed the cost would have to increase by 150%, 200%. So the challenge is how to make this program sustainable. So how do you come up with a financing model, the innovative financing model? There's no way you can sustain this with just government financing. So how do you bring parents in? How do you make that equitable? Is there are there feasible ways to cost share between parents, local government, central government? So I think the financing issue is going to be the next challenge for these programs. Okay, so I'll start with Mr. Ayete's question. Um, yeah, so 264 programs in 102 countries. Yeah, that's exactly why. Because some countries have multiple programs. So usually WAP, for example, could run a program in a certain part of a country, and the government covers other parts, or different international organizations may have multiple programs in one country. That's usually the case in low-income countries, and so these are not national programs. And I think in the Gambia, you have two programs, right? The government program and the WFP program. And in a country like Mali, for example, I think there are four programs run by multiple international organizations and charities. So that's why. So this analysis is at the program level, and that's the advantage of this analysis. It's not the aggregate country level data, it's program level data. So you are able to look at efficiency, this things like cost efficiency, program design features that are more appropriate to be studied at the program level than at the country level. The question about standardizing cost. I think, yeah, I think it's useful to standardize cost, even at the country level, to standardize cost by meal days, because schools programs can provide meals for varying number of days per year. So I think it's important to standardize that. A number of days is an important metric in terms of cost per child. And if you want to compare countries, you have to standardize by at least the price level and the currency, the type of currency. And the social goals and the efficiency. And I think that relates to Deborah's question about centralized kitchens and unemployment. So those two questions are related. And I think that's the challenge for most governments, because school feeding programs are politically popular. And so that's good. I mean, it helps to keep these programs politically popular, for governments to keep investing in these programs, because they are important for them for more reasons than feeding kids, to create employment. From a political point of view, that they're important. But I think that the question, the tension is, if it undermines efficiency, because I don't think creating jobs through school feeding kitchens is a sustainable way of job creation. So you either create jobs in agriculture or manufacturing. You don't. I don't think there is any country that has transformed its economy through job creation in school feeding kitchens. So that's an inefficient way of job creation. I think even in terms of this broader social goal, if you are able to save on budget in school feeding program, you can allocate these budgets elsewhere to create jobs more efficiently. So you could create, for example, public works programs, which are more, labor intensive, and so I think it's you have to look at it from an economy-wide point of view, and efficiency is important, and sometimes social goals might be important, but you shouldn't undermine the efficiency too much because of the social goals. So yeah, but at the end of the day, it's a political decision. Okay. Are there any more questions, or should I just answer them? Okay. Yeah, I think I think that's from a practical, from a policy point of view, sitting in Ministry of Finance or Ministry of Education. I think that's the key question. So how do you make decisions? How do you use this type of analysis? Well, at the end of the day, this is a comparative analysis, so it's not just about one country. So it only gives you some guidelines, and then some rough um, roadmap, things that you need to take into consideration when you make decisions. But it will not definitely help you to answer those questions, those critical questions at the country level. So I think you would have to be able to learn and iterate. So I think it's governments should be flexible. So you pilot programs and learn from their performance. And I think collect operational data, monitoring, improving monitoring and evaluation, I think is very important for all programs, because that helps you to learn from their performance. And these issues, for example, the dietary diversity, the consistency of provision, and the quality and the quantity, even the quantity of provision, uh, these are key for decision making. When you evaluate a program, when you assess whether a certain model has worked or not, you need to have all those parameters in place. You need to and you need to have data. And I think that has been at the center of the Team Ghana's problem. I think they will talk about that. So how to improve decision making through more information. So information is important. Flexibility is important. But at least this type of studies give you a broad an outline of the issues and the different choices that you might consider. Um, and yeah, I know the quality versus quantity uh, question is going to be an issue for all countries, because these programs are inherently political. So you want to expand, the governments want to expand to increase the number of kids. So yeah, but there is so much technocrats and ministries of finance, ministries of education can do if they have the data. So I would say the most important thing is collecting data, understanding how programs work. Thank you.
Thanks for joining us again. So we have a presentation from ODI Global. It's a global affairs think tank based in the UK with presence throughout the continent. And we have with us Harshal Parekh, who's the country lead for TaxDev, and they work on tax policy in a variety of African countries. And he's going to present us ongoing work on health taxes and earmarking that for school feeding programs. I think, as far as I understand, this is sort of a draft toolkit. And so they're very keen to hear our feedback, how relevant it is for you in your work, what potential you can see for this to be incorporated in your country. So let's hear from Harshal, and then he'll take questions and feedback from the room. Thanks for joining us, Harshal.
Thank you, Danielle. Thanks for the opportunity to present, and welcome everyone, and good morning. I hope your first day of the workshop went well, and I hope to set you off on a good start for today as well. My name is Harshal Parekh. I'm an economist by background, and I've worked in tax policy since 2016. I have been based mainly in Rwanda over that time, working in the Revenue Authority and the Ministry of Finance on the tax policy side. And that's through the tax dev program. Generally, I'm an independent consultant, and this is a separate project from the tax dev program, but it's being run by ODI Global. And yeah, I will give you a bit of context first on the project before we go into anything on the contents. First, so I would like to ask our colleague, because that might be the best way of introducing the context, my colleague Miriam, who's going to explain a bit more about the school meal program context of this particular project. Miriam, can I hand over to you?
Yes, thank you very much. So, hello everyone. My name is Mariam, and I am the country coordinator for the Sustainable Financing Initiative for School Meals and Nutrition. And just to give you a little bit of an introduction, so do you mind if I start sharing the SFI slides instead, Arshil?
Go for it. I think you can share now.
Perfect. Thank you very much. So let me know if you can see my screen. Perfect. All right. So just to give you a little bit of a background, so the Sustainable Financial Initiative for School Health and Nutrition is an initiative of the School Meals Coalition. It was launched in 2022, and it's really with the goal to work with government and donors to identify multi-year financing opportunities for school feeding programs with a particular focus for low-income countries and low and middle-income countries. At SFI, we focus on 3 areas. The first one is analyze, the second one is act, and the third is amplify. I will quickly go through each of them, but analyze is really to help us undertake like research and analysis of global and national financing for school meals. The second one, which is act, is really like to work with country governments to support the development of financing strategy. And the last one, which is amplify, it's really more of advocacy work where we advocate for greater investments in school meals. Trying to move to the next slide. Oh, okay. So just to define sustainable financing in the context of school meals is really making sure that sustainable financing for school meals is secure, adequate, stable, and predictable, and that it covers the operational as well as the capital costs of high quality programs. And in this dimension, equity is quite important because we really want to ensure that children are that are affected by poverty, gender disadvantage, marginalization, and food insecurity can now benefit from school meals, which requires a focus on both progressive resource mobilization as well as equity in public spending. And we define sustainable financing in the context of school meals in 2 areas. The first one is really looking at sustainable revenue streams, which are recurring and predictable. So that's really looking at for school meals, how to cover like the operational cost to run the programs. It can be looking at regular revenue, such as the general government revenue, allocations, earmark taxes, the contribution from parents or from the municipality, from the community, etc. And the second part, it's the investment part where we really look at innovative ways to get financing. So that can be, of course, through grants and concessional loans, but also looking at other type of financing mechanisms such as like blended finance, carbon credit, and debt swap. And this part of the financing really usually covers the CapEx investment in physical infrastructure. So that's looking at like kitchen facilities, clean cooking solution, and sometimes like upscaling the personnel, whether it's like the cooks, the caterers, the smallholder farmers, where usually we get the food from. And so in the first section that I was telling you that we focus on the analyze part where we do research and analysis, one of the key messages that that came up from one of our latest reports on school meals was that, first of all, school meals are a no-brainer. We've seen how they boost learning, health, nutrition, and local economies. And coverage is still low, unfortunately, because we're talking about 18% in low-income countries and 39% in low and middle-income countries. Financing is the biggest barrier, of course, because fiscal constraints are limiting the scale up, especially in low income countries. And another SFI project that SFI paper projects that increasing coverage to 60% will actually allow an additional 260 million children to be reached by 2030. And it will actually require quite a big incremental increase in school meals funding of like 3.6 billion. And the last part is that, of course, we need new funding sources, so innovative finance that can bridge the gap and unlock the co-benefits. So just to give you an idea of a few, I'm not going to go through this on detail, but just to give you a few idea of some of the financing mechanisms that are interesting. And one that we're going to talk about a lot today is, of course, the sin taxes. And it's really a good one in the sense that it offers triple wins, as it raises revenue, it improves health, and it offers progressive outcomes. And they already are playing a role in national budget and health financing, but could be earmarked for school feedings. And in the Philippines, for example, sin taxes in that sense is taxing alcohol and tobacco products. And now it's true that they are directly funding a large part of the public health system. Taxing sugar also is another option, and it targets children and really present a strong political case for action. Another that is really interesting is the natural resource that can power school meals. So taxing extractives, for example, which can really increase finance, we can sustain finance programs in resource-rich countries. And for example, in Bolivia, the revenue from hydrocarbon finance had 70 is financing 70% of the national school feeding program. Another interesting financing option is debt swap and debt release. And the World Food Program has already done 12 debt swap for school feeding, especially in Madagascar. And it's really touching on education, social protection, nutrition, and climate. And it's really basically in this case, taking the debt that a country has toward like a more, let's say like a more developed country, and repurposing that debt to actually cover like education, and in this case like school feeding. Of course, there are limits because it depends on the type of creditors, the technicality, the national debt swap situation, etc. And another option is climate finance, which really support adaptation and resilience that are still overlooked. And climate finance flows have increased dramatically over the last year, but school feeding is a marginal sub-theme in terms of climate funds operation. And other financing options are parental or community contribution that I briefly mentioned in earlier. So in Cambodia, for example, we're talking about like how pocket money is actually really important to finance school meals. In Cameroon, we are talking about contribution in nature. When we look at municipal revenues, for example, which is like the local government, which can finance part of the cost of school feeding programs. In Benin, for example, estimation of potential contribution from the local governments based on their revenue and financial government index have seen quite a lot of impact and have really been attributed directly to school meals. And then when we talk about the private sector, we can talk about public-private partnerships. We can talk about blended finance that can boost like the local supplies. It won't necessarily fund meals directly, but it can strengthen the supporting system. And we've also seen corporate social responsibility, where, for example, in Senegal, there's some organization that have like a revenue that they give to school meals, and they consider that it's part of their corporate social responsibilities. So these are just like a few options that exist. And then when we talk about like ACT, which is the work that we do with governments to support the development of financing strategy, as you can see here, there are some countries where we are quite advanced in terms of the work we do. For example, in Kenya or in Cameroon, etc. There are some countries where it's ongoing support. So we are currently like helping them develop their financing strategy that I will touch on shortly. Mauritania, for example, and Zambia. And right now we have quite a bunch of countries that we're doing like initial engagement and assessment to see like how we can support them better when it comes to like financing school meals, Ethiopia, Pakistan, Zimbabwe, etc. And what we do, especially at SFI, when it comes to the development of the, is basically we help our countries develop a sustainable financing strategy. We do this in between 9 and 12 months, and it start with a scoping and planning phase. Then we provide a fiscal space analysis. Then we do a cost analysis because we have a costing tool that allows us to just see what part of the school meal should be taken by governments, what part should be covered by donors, etc., etc. Then we realize the financing strategy, and then we end with a validation phase with, of course, the Ministry of Education and the Ministry of Health, and sometimes the Ministry of Social Protection when this ministry is actually really involved when it comes to school feeding. So this is really a strategy to help guide the government into what would be the best way for them to have innovative financing for school meals, and also after that to start implementing and working directly, for example, with the World Food Program when it comes to school feeding. And the requirements for most countries to be part of SFI and for us to support them is that, of course, they have to be part of the School Meal Coalition. There has to be political commitment from school feeding, because it's not really useful for us to be doing like all this financing strategy. If the government is not fully on board, and if this is not going to be implemented or taken like to the ground. The third one is that the national school feeding strategy and program are in place. The fourth one is that there is a budget line or a willingness to increase budget, which goes really closely with the political commitment mentioned before. And number five, there has to be a country request and a willingness to actively support the process and own it, including from the Ministry of Finance, because most of the funds do come from them, even if the Ministry of Education is highly implicated in this scenario. And the two latter are the partnership working and cross-sectoral approach, because this requires working with quite a bunch of organizations. And finally, the feasibility. So having data availability and political time. So just in general, that's what we can say to give you a little bit of idea of school meals financing, as well as what SFI does. So thank you very much. Over to you, Ashia. You're on mute, by the way.
Thank you for that, Mariam. So to then come back to this particular project and what it's trying to do. So we've seen Mariam has shown us about the importance of school meals, essentially, and the efforts that are being taken to think of innovative, sustainable sources of financing. One of the options that she talked about was health taxes. So this project is about focusing a bit more on that as a particular option, and thinking about how to produce something more practical, so like a practical roadmap for governments looking to introduce or reform a health tax and potentially earmark that revenue to fund school meals. We want this to be an accessible guide for policymakers. So it's not just for people with a public finance background, it could be people with a health, nutrition, education background. And to apply in their context, it's not about selling one prescriptive solution or saying that there's one way of doing it. It's for something that can guide any country or any policymaker to think about what might be best for their context. This is being done by Sustainable Financing Initiative and ODI Global together, and is funded by the Rockefeller Foundation. And as Danielle mentioned in the beginning, this is a draft toolkit that we're presenting, and we would really welcome your feedback. If you have any questions to clarify something as we go along, please feel free to ask, and Danielle might be able to help me help to flag those so that I can take a pause there and take your questions. Thanks for that. And the structure of the presentation is that we're going to cover a little bit of the context on fiscal space, the school meals, and health taxes, how the three are connected. Then we'll focus a lot more on tax policy. So what are the tax policy principles underlying this? What are the objectives of a health tax? And how does practical design then come into it? Then we'll cover some points about political economy considerations, and then a couple of things on earmarking before we open for some questions and feedback from you all. So starting with something on the fiscal space. So we might be aware of this term, the polycrisis. So this is talking about the series of global shocks which have been happening and which have had a lot of implications for governments and their ability to spend. These global shocks are things like starting from COVID, then we've had global conflicts, we've had inflationary pressures, we've had borrowing costs increasing as a result, we've had growth slowdown, we've had aid cuts, and we've had kind of tariff reactions in more recent times as well. These are all shocks which have influenced the fiscal space available for governments. And by that, I mean how much they're able to finance the spending that they want to, or that they had planned to for the sake of sustainable development goals. This has led to limited spending or limited availability of finance for school meal programs. Just to give you an example, debt repayments, they were estimated to be at around $87 billion in low and lower middle income countries in 2023. And that's greater than the spending that was available for health and nutrition. And then as a result, this is slowing down progress against the sustainable development goals, which can then be reinforcing in terms of creating a bit of a vicious cycle. Now, I won't need to tell everyone in the room about the many benefits of school meals, but I will just give an overview. So the primary objective, or the most direct objective, is to address undernourishment of children. And we have figures showing that 143 million children around the world are undernourished, and quite large shares in low-income countries and lower middle-income countries. So obviously, school meals can have an impact on undernourishment, but it can also have wider impacts. So it can also help address nutrition imbalances. It can bring the right kind of nutrients into people's diets, and that can help with things like obesity and stunting as well. It can improve educational outcomes, so more participation in school, more continuation in school, and better educational performance as a result. In the long term, it can help with productivity. So when children become adults and they're part of the labor force, but even before that, they're going to be more productive from an economic and social perspective. Then school meals also have an impact on food systems. So they improve food security and they transform food systems toward regenerative agriculture. So strengthening the local value chains rather than relying on imports or unhealthier foods. And then they will also have an impact on reducing poverty and improving social protection through food security. Now, when we're thinking about the link between health taxes and school meals, so Mariam has just covered some of these points as well. The revenue potential of health taxes is considered to be quite large. The current revenue from tobacco and alcohol is around 0.3 to 0.6% of GDP, but the potential is much higher. And one report estimates up to $2.1 trillion more for low and middle income countries over 5 years, looking at just alcohol, tobacco, and sugar-sweetened beverages. The health potential is also there. One report says 50 million lives can be improved or saved over 50 years. So the school meal side also has obviously a financing need, and that one is estimated at around 3.6 billion over 5 years if there's 60% coverage. So what's the common thread between these? It's obviously the revenue side. So health taxes have the potential, the revenue potential to fund school meal programs, and they're both woven by the same thread of creating better health outcomes. In the case of looking at some types of health taxes, they might also be affecting the same group of people in society as school meals are, meaning children. So the triple benefit Mariam also mentioned, that is quite an important thing for thinking about how health taxes and school meals then can join up together. So the health taxes can directly discourage harmful consumption. If we're talking about sugar, they can directly discourage people from drinking soda, for example, and that can reduce the sugar content and therefore have an impact in itself. Even if that doesn't happen, you can generate revenue as well. So there's a revenue generation impact. That's something in itself. And depending on how you want to use that revenue, you can improve progressivity. So what kind of things might be subject to a health tax? Well, there are some things which are very well known as traditional products that are subject to a health tax, and there's some which are kind of new and getting more popular, and some which are a bit more in a conceptual stage. So traditional ones are things like alcohol and tobacco. Sugar is becoming an increasingly popular option for something to apply a health tax on. And then there's others like salt and saturated fats, or you could think of it as ultra-processed foods together. There's caffeine potentially, and there's even social media as things which all impact health and could be subject to health taxes. The focus for the toolkit that we have produced is on tobacco, alcohol, sugar, and ultra-processed foods, because those are the ones for which there's a bit more evidence. But the considerations that we lay out could be used for other products as well. I want to go through also, as I go through the slides, a hypothetical example of a country that might want to focus on a type of tax and to show how the toolkit can be applied. So let's say that there's a country X which wants to focus on a sugar tax. Well, first thing to understand is why some things might be overconsumed. So there's 3 reasons why that might happen. One of them is negative externalities. Negative externalities happen when the price of a product doesn't take into account all the costs on others in society. So, for example, if I smoke a cigarette, I might not take into account how it affects the health of the people around me. So I'm imposing a cost on them as a result. But if that cost is included in the price of what I buy, then I might buy less and therefore take into consideration the impact it has on other people. So that's why tax is seen as a popular solution whenever there's a problem of a negative externality. Another reason why things might be overconsumed is called a negative internality. So this it happens when consumers don't make the choices that are best for themselves. It could be for their present self, or it could be for their future, but you still keep consuming it because it tastes nice, and there's an addiction element in that. So the appropriate policy instruments, if you're trying to deal with an addiction or a negative internality issue, is wide-ranging. It can be tax, but it can also be other things like regulation or legal interventions. It could be that you impose some kind of bans, or you you put age restrictions, so children cannot buy or consume certain things. You might put legal sanctions, like for drink driving, for example, or you might put marketing regulations so that a pack of cigarettes doesn't look as appealing when it's in a shop. Then the third reason I want to cover for why things might be overconsumed is imperfect information. It might be that you actually, as a consumer, don't know the long-term health impact or the addictive nature or the nutritional content of what you're choosing to consume. So the most direct way of dealing with this is to address that information gap, to find ways of improving the availability of that information on what you're consuming. So this could be like campaigns, awareness campaigns. It could be education initiatives. It could be better labeling of products as well. So what we can see from these 3 points is that the best way of dealing with the overconsumption of something depends on why it's happening. If we continue with the example of sugar, it's less about negative externalities and it's a bit more about addiction and information. So it might point towards tax, but also non-tax solutions. Even if we're thinking about the non-tax solutions, government can still play a role in terms of the fact that, taxes can still play a role because the government interventions might still need funding. So because of that, health taxes can have two different but important purposes. So one of them is about discouraging the consumption of those products, meaning like a direct health impact from using the tax system. So you tax the thing that's harmful and you try to encourage the change in that behavior. A second way is by thinking of the revenue generation side. So in this one, you might be trying to do something a bit different. You might be trying to tax whatever people will still consume and therefore generate revenue while not changing behavior. Now, both of these are valid ways of addressing overconsumption, assuming that the revenue is there to fund a health intervention. Given that we're talking about health tax, you might think that the revenue can be in some way linked to a health policy as well. The best tax design depends on the balance between these objectives. So you might have an objective of discouraging consumption, but also wants to generate revenue at the same time. Then you need to strike a balance, and then the way that your health tax would be designed depends on that balance between the two. But it's not just that. There's practical considerations which have a big influence as well, and we see this in reality. So there are all things to do with administration. Is it simple to apply? Is it easy to enforce? Is there a risk of under-reporting of the tax? The legal side, so is it easy to define what you're trying to tax? How does the behavior of different people involved change when you apply this tax? So consumers, are they changing how they behave? Are suppliers also changing how they behave? Who is the ones who are actually paying the tax? And are there even secondary objectives? So are you having to think about employment, investment, maybe local production versus imports as other objectives that you're having to try and balance in that? So you can see it's not a clear-cut thing. There are a lot of things that need to be carefully handled. And in that example, let's say country X wants to put equal weight on directly discouraging sugar consumption and on raising revenue to finance school meals. And it wants to do it with almost equal weight on both objectives. Let me also pause there for a minute and just check if there are any questions at this point.
Does anyone want to ask anything? Or? Okay, Harshal, I think you can continue.
Okay, super. So keeping that in mind, then I want to go a bit more into the tax options that you have for thinking about how to design a health tax. Some of you might be familiar with this phrase ad valorem. So there's one type of tax which is called an ad valorem tax. This it just means that the tax is applied on the price of a product, like a percentage of the value. So let's say it's a tax of 50% of the price of a beer, as an example. So that means that when the price is higher, the tax is higher as well. But it also means that, let's say, a cheap soda with lots of sugar would be taxed less than an expensive soda with less sugar. So it's not targeting the harmful contents directly. But it has other advantages. Whenever there's inflation, the tax will automatically adjust, because when the price increases, so does the tax revenue, the tax on that product as well. And price is something that's relatively easy to observe. So that can make it simple to administer and implement, even if sometimes there's a bit of an under-reporting risk, meaning that some people can say that the price is lower than it actually is. Then there's another type of tax, which is called a specific tax. So this is where the tax is a fixed amount on the quantity of a product. And then one version of a specific tax is called a volumetric tax, meaning it's a tax on the volume of a product. So this could be the number of liters for like soda or alcohol. This could be the number of kilograms for sweets or chocolates. And it could be the number of cigarette sticks as well. What it means is that as you consume more of the products, the tax is higher. So when you consume 2 liters, the tax is twice as high as it is for 1 liter. Now, this one then has the benefit that it's partly targeting the harmful contents. As you consume more of the products, tax is higher. But because it's specified in the currency unit, so it might be like 100 francs or something, then that means that when inflation happens year on year, it needs to be adjusted to keep up with that. The main plus sides of this are that it's administratively simple. Like you're just counting the quantity, which is quite easy to observe, and there's a relatively low risk of it being underreported. Then you have another type of specific tax, which is called content-based tax. This is a tax on the harmful content in the product. So this would be a tax on, for example, the liters of pure alcohol. So not the size of the bottle, like a 1 liter bottle, but how much, what's the volume of actual alcohol within there, or the grams of sugar or salt, or even like how many milligrams of caffeine there is in a product. So in principle, this one is best for discouraging consumption of the harmful content because it's directly targeting that. It means that when there's more sugar in a drink, whether the drink is the same volume or not, but when there's more sugar, it's taxed for. So it's very good in that way, and it even gives an incentive to producers to reformulate, meaning that if you're a producer, you know that your tax will be lower if you reduce the sugar content or the alcohol content or something like that. So it creates that other incentive as well. And we've seen that that actually happens in practice too. Like the other specific one, it needs an adjustment for inflation. But unlike the other specific one, it's more complicated administratively. So to observe the exact sugar content or whatever it is, the harmful thing, is a bit more complicated. And there's a bit more of a risk of underreporting. So if I give the example of Rwanda, where they were considering doing a content-based tax, one of the challenges there was that it was considered too difficult to be sure that the product labels had the accurate information about the alcohol or sugar content in those products. So the risk was considered too high at that particular point. And generally, content-based taxes are not that common in low-income countries and lower middle-income countries. Some countries combine ad valorem and the volumetric tax to balance the pros and cons of those two options. And fewer have used a content-based one so far. You might have an example of country X where it's then considering, because of the dual objectives, it wants to apply a hybrid tax on sugar, so ad valorem and specific together. Ad valorem maybe with a view to raising revenue from the more expensive products, where you might think that people don't change their behavior, even if you increase the tax, and the specific to discourage the consumption of the cheaper products as a result. Now, that's on the tax side and looking very much in the technical details of how to design kind of tax policy. If we think about a health tax, it's politically sensitive in every country. So there's a lot of things to consider beyond what we've just talked about. It means that there's preparation needed to understand, for example, who your allies are in civil society, within government ministries. There tends to be a natural kind of group of allies between the Ministry of Finance, Ministry of Health, and Ministry of Education for such a policy. And then you need to think about what your policy-making process looks like. Are there points at which policy can be vetoed, so objected to? Or are there really key stakeholders in the process who are very influential in that? Then are there commitments that the country has already made for its medium to long-term vision, saying that this is what we want to do to have a healthier population? And therefore, can you align the policy that you want to introduce with that long-term vision? Then it's just a case of framing it as an implementation of a vision that's already there. You can bundle this kind of policy, if it's raising revenue, with another that's reducing revenue, so that the two are more acceptable when they come together. You can also find easier wins. Let's say you already have a tax on cigarettes. Then you can say that, all right, well, we're trying to discourage the consumption of tobacco. Surely under that same rationale, we can extend it to also tax e-cigarettes too. And then you can think about effective communication. How do you communicate this to the public to highlight the benefits and make sure that it's understood that this is a positive thing? One way of trying to build that support from the public and showing that it's a positive thing is to think about strategic earmarking. So you can use earmarking to try and say that we're going to get this revenue, but it's going to go towards school meal programs. That can be a good way of building support, but it also has technical risks as well, which I will go into quite quickly now. So earmarking is a detailed topic on its own, and it's being used to fund health, education, and social sector programs a bit more. And Ghana is a well-known example of that. We can see that generally looking globally, it's being done a bit more for the revenue that comes from tobacco than the revenue that comes from taxing sugar-sweetened beverages. So as we mentioned, one of the key benefits is the public support. Another one is stable funding. So this one can give sustainable financing for something like a school meal program because it guarantees in a way that funding over time. But the challenges are quite important to note as well. It can make budget less flexible because you're making a commitment that that money will be used for this particular program. Well, what if government's needs change? What if there's another shock? Or what if something else becomes more important to focus on? It could even be that the implementation of the program that the fund is earmarked to gets delayed. Then you have a problem because the budget becomes less flexible as a result. And if your revenue source is not very stable, then you can actually create a problem for the program that you're trying to fund because the revenue might reduce over time. Let's say you're discouraging sugar consumption and then your tax revenue falls because people are consuming less of that product, then the revenue might not end up being enough for the school meal program or whatever else it is that you're trying to finance. So we have to keep in mind that medium to longer term picture in terms of revenue sustainability as well.